Hey, Happy New Year, and welcome to the first episode of 2022 of Your Personal Health. And we're going to have Dr. Kim and Dr. Burris on here in just a moment. But I just want to welcome you all to a new year. And we thought, hey, let's kick off the new year because as a new parent, new year, you probably have some questions. If you don't have some questions, you're going to be moving from, let's say, an obstetrician to now a family doctor or a pediatrician because you now have a baby in the family. And you kind of want to have an idea of, hey, what kind of questions should I ask a pediatrician? And because Dr. Burris is a pediatrician, it makes perfect sense. And it also makes perfect sense because Dr. Michael is a family health doctor. So all this comes together as your personal primary care physician that you can ask these questions. So we thought, let's kick off the year with some questions. So let's bring them in. Welcome, Dr. Kim and Dr. Burris. How are y'all guys today?
Pretty good. Happy New Year.
Happy New Year to you too. It looks like we all made it. Dr. Mike, I love your bright and festive scrub top. That was very nice.
Thank you. It's Marvel.
Oh, Marvel. Oh, so you're marvelous. I like that.
Something like that.
All right. So anything happen over the course of the holiday that you'd like to share before we jump into today's topic, which is asking those questions as a new parent?
Well, we applied to a lot of colleges as a family, I guess. We're in the midst of that season with one of our children, and so
the FDA did just approve the 12 to 15 age boosters for.
And so we have a child in that age group, and we've been hoping to get her boosted before Omicron hit, and we're kind of not quite. We're just like a week too late.
Oh.
But she didn't get sick yet, but I'm hoping that now that the FDA has approved it, it'll go to the CDC and that committee will meet, and then once they give the green light, it'll be available at your local pharmacy, for instance. So we should be just a couple more days away from getting that approval for a booster dose in that 12 to 15 age group. So we'll see what happens. And then with Omicron, it's spiking now and probably will continue to increase in cases over the next week or two. So we have another couple weeks of this, but it also looks like it's coming down in other countries as quickly as it went up. So it's a fast curve up and also a pretty fast curve down. So hopefully that holds here and we'll have that same experience. It's also looking like it's not as severe as the Delta variant in hospitalizations and deaths. So that's also some good news. That doesn't mean it doesn't cause problems for people or cause hospitalizations. And our hospitals are going to definitely be hit hard over the next month or so. So if you can, please try not to catch it. It would be very helpful for yourself and others.
And the other problem that's occurred because so many people are positive at once, the whole valley is out of all the IV infusions of antibodies. You cannot find, well, I wouldn't say 100%, but it's very difficult. In most places, even Eisenhower does not have the ability.
Well, as of 2 days ago. Yeah. So things are always changing on a daily basis. But when we see a spike in cases like this, it causes a huge drain on availability of things like tests and treatments. So even though treatments are approved, doesn't mean they're going to be available. And so that's another reason to, not be too flippant with, oh, it's not that bad. I don't care if I get it. I can just go get some monoclonal antibodies. Well, maybe not. So especially if you're high risk, just taking some really good precautions over the next week or two can go a long way to keeping people safe and keeping them out of the healthcare realm right now, which is under tremendous strain. Yeah.
I want to ask you a little bit about this, the CDC recommendations, and some states, California in particular, saying, "Hey, we should have a little different." I know they've gone from the 10 to the 5 day, but back into after that 5 day, what should be that recommendation? I know that I think the CDC is saying, "Hey, just if you're going to go back after 5 days, put a mask on and away you go." But California and some other states said, "Hey, we'd like to have you tested and make sure that you're not still positive before you go back out into the public." Where are we at on that, and what's your thoughts on that?
My thoughts are, if I was going to create maximum confusion and disarray, I would do it this way. So, um, so yes, there are changes and no one knows what they're doing right now. And everybody has some reasonable data behind their recommendation. So the current recommendation from the CDC is if you're asymptomatic at 5 days, which means you have no symptoms, then you can come out of isolation. But if you're around other people, you have to wear a tight fitting mask all the time. That means don't even take it off to do your face recognition, because we don't know whether or not you're still contagious. California's like, we're not real comfortable with that. We want to make sure that people have like a negative rapid antigen test at that 5 day mark. However, that means you're less contagious, but it doesn't necessarily mean you're not contagious. So a lot of these are recommendations that are being made on about 90% of people are going to be okay doing it this way.
Mhm.
So there's always some nuance. And depending on who you are, whether you're an employer looking at staffing shortages and you want your employees to come back, that might be okay if you're in an office setting. But if your employees are in a nursing home, you might be a little more concerned that your patients could become infected by that staff member who was positive. So there's so much nuance and confusion around this that I'm telling people, if it's possible for you to go ahead and isolate for the 10 days, that's your best bet. If you must go back to work, then make sure you're wearing that tight fitting mask after that 5 days and test negative before you go back to work. I think that's probably reasonable. Just anecdotally, you hear things through the grapevine, and I know of quite a few employers locally who are requiring that their employees work even when they're sick with positive tests.
Wow.
So just kind of keep that in the back of your mind. This sucker is everywhere right now. And there are people who are pretty desperate and who are working sick either because of their own need to work or because their employer is forcing them to work or pressuring them to work. So just sort of assume everyone you run into has Omicron right now, and you'll probably take about the right level of precaution.
Wow.
Yeah, I mean, I think the CDC recommendations are built on if all of this in the best case scenario occurs, and if this occurs, then follow these guidelines, which is true, but that just makes a lot of assumptions. And like Dr. Burris was saying, if you have 10 employees and one is asymptomatic, can you get away with it if they wear their mask all the time? But we know, even ourselves, we don't do that. And so we're just going to get everyone sick. And it's true that most people aren't going to have a horrible problem, but eventually it's going to run into someone who does. And then you're just going to take everyone out at the same time. And that's the problem is, right, if in a small office like us, if 2 people go out, well, we're not functioning. If you take out 2 ambulance crews, that's many people who can't get their heart attack or their stroke or their fall or whatever. attended to. So it's kind of a ripple effect, even if we're not talking now deaths and hospitalizations. We want to prevent from it spreading, and that sucker is going so quickly. It's crazy.
Well, that's what it sounds like. Is I know over this holiday, we were with two different couples on two different occasions, just the four of us, and the number of people that they're talking about that now that they actually know who had contracted COVID with this Omicron variant is just off the charts. Like everybody they know caught it. And it's interesting how this time it seems like there's a different level versus Delta versus original COVID, where it was always like it was somebody out there, right? It was never that close. Now it seems like it's like almost everyone is getting it. Is that with what you're saying? Hey, just prepare for it. And I should no longer make fun of the guy who walks by my house with his dog and he has a mask on and he's outside by himself. The fact that he's really taking the proper precaution.
Yeah, we increased our mask wearing to the N95 level when we're going into public places. So it used to be that I would feel fine in a surgical mask, and now I wear my N95. And again, I'm not pulling it down to do face recognition on my phone. I'm definitely minimizing the time I'm in stores, maybe skipping a visit to a store if I don't really have to go. Or maybe we'll only send one of us in instead of both. Just like doing what we can for the next week or two, just to decrease the amount that we're exposed to a lot of people. We have jobs where we work with people we know are already COVID positive or likely to be. And so we're wearing full PPE, but I'm not wearing full PPE when I go into a grocery store. Not yet. But I do wear the most important part, which is that N95 mask.
Well, I think this is some really good updates for where we're at right now today, the 3rd of January in 2022. And it sounds like the worst of the COVID-19 variants, if you will, is kind of behind us. And yet we're not through the woods yet. Like you said, another 3 weeks with this go around. And boy, just get your booster, make sure you're vaccinated. And as you say, as Dr. Kim has said, hey, really work with that Swiss cheese effect as much as you can. You can't wear your PPE all the time, but something you said that I took note of is, moving it up to the N95 mask all the time, not just under extreme conditions. So thank you for that. Well, let's dive into today's topic. And, since we said, hey, it's a new year, probably a lot of new babies out there being born over the holiday. I know that I remember seeing on my phone pop up that there was, they announced the new baby, the first new baby of 2022 at, I think it was a Desert Regional Hospital was announced. I don't recall the name off the top of my head, but as a new baby or as a new parent, there are probably some excitement, the whole part of that, but there's probably some questions you probably want to ask your pediatrician. So I thought, hey, let's kind of go through a few of these and start from the top of what's the most obvious to working through some of these and see what your advice is on this. You ready?
Yeah.
Yep, that sounds great.
Yeah.
Great. Do you both have your buzzers in place for the answers? No, I'm just kidding. Okay, so the first thing you should ask is, and this is from a group called Scary Mommy. It's she has a blog that's read by millions of people and it's very popular. So this is a list of questions that she had on there. I thought that's probably a pretty good spot people are going to. It says, "What is your medical education, training, and certification that I can feel comfortable as a new parent bringing my newborn to you?"
Yeah, actually, this is not a bad place to start. The question is, what do you do with the information that you get when you ask the question? And so there are different levels of training for people who work with children. There are people who do pediatrics as part of their whole practice, and then there are people who only do pediatrics. And there are pros and cons of each type of provider, and they're both good at what they do. We happen to be the type of doctor that takes care of all ages. Mike is a family practice doctor, and I'm a med peds doctor. So in my case, I'm actually went through a pediatric residency, but I also went through an internal medicine residency. Mike went through a family practice residency, which incorporates pediatrics. Just to give you kind of a ballpark of the different types of training, I would say that his training in pediatrics in residency was about 6 months. Would you say that that's about accurate?
In all 3 years?
In all 3 years.
Probably a little more, but
so somewhere in the 7 to 8 months of training. I had a 4-year program, and 2 years of that was dedicated to just pediatrics in different types of settings. And then a pediatric residency alone is a 3-year residency. And so then you'll meet, and these are for people who've trained in the United States and gone through a residency in the United States, and these are for doctors. If you're seeing a nurse practitioner, they're going to have a different level of experience and training. So these are all questions just to give you an idea. Finding out where a person trained is also sometimes useful just to understand their background. So, for instance, we did most of our training at a large city-based research hospital. So lots of inpatient and specialty training, lots of access to sort of cutting-edge stuff. And that's going to be a different training program than someone who, for instance, trained at a community hospital-based program. The nuance of this is probably not going to be all that useful for the average person. But if you have a special needs child with a complex heart history or a genetic disorder, you may want a pediatrician who has more of that as a background. If you're looking for a regular pediatrician for children who do not have those complex medical backgrounds, I think this is probably going to be less critical of an issue. And honestly, it's more important to get someone who has the ability to connect with you and your child. To have somebody who has good rapport with your child and can interact with them and allay their fears, that doctor, no matter what kind of training they have, is going to get a better exam, a better history, a better idea of what's going on. And if they're paying attention to what the parents are saying as far as their concerns and what's been going on with the child, you're going to get a really good outcome.
And I will say, just to defend family medicine a bit, is that, family medicine is rooted in the clinic outpatient world, kind of where 80% of clinics or care occurs. Yeah. And pediatrics, they do outpatient, but they spend a lot more on the inpatient side, so they don't get as much outpatient side. So there's pros and cons, but I think, like Dr. Burris said, the bottom line is not really are you a family medicine or pediatrician doc, and where did you train, Harvard versus UCLA versus some smaller city. It really is, are they a good person? Are they a good doctor? Do they care? Are they asking the right questions? Do they seem like they want to connect with you versus are you in and out the door?
Yeah.
Well, that really helps clarify that whole thing of like, what degree from what school do you have on the wall versus what was the reason for it. And it's the second question is, hey, why did you decide to become a pediatrician? And that kind of dives into that next question of because as we've talked about on the show before, and again, this is not a negative, this is an awareness thing of many doctors are not choosing primary care physician or pediatrics because of financial reasons. And so when someone chooses that, it's kind of interesting to say, hey, why did you choose to become a pediatrician? It may tell you a lot about that individual, that they have this desire inside just to do a different job. Is that fair to say?
Yes. When you look at pediatrics, it's a field where the relative pay is much lower than other specialties. And also, there is within medicine sort of a hierarchy of respect. And although I have a super high regard for a lot of the pediatricians I know, and I feel like this is not an accurate assessment, the reality is if you choose to go into pediatrics, you're going to have other doctors say things to you like, why? Because in general, it's not a really desirable field for a lot of people, partially because the pay is low. So if you're talking to a pediatrician, asking them, hey, what prompted you to go into this field is something, honestly, not a lot of people ask us. So the answer to that may be really interesting to you, and they may be really excited to tell you that, what their passion is or what there is about the field that really excites them. And that'll give you a good idea of where that doctor's focus is going to be and what they're going to want to spend time on.
So do you like that question as one of those, I'm going to say top 10 questions? Why did you choose to pediatrics?
I've never in my 25 years had a patient ask me that question.
But if you were to be asked that, is that a good, you say that's a good question to ask, or no?
Yes,
It has no
absolutely.
relevance?
I think.
I would say if this is a visit that you're trying to get to know your doctor,
Yep.
if this is your first visit and you have agendas, you've just burnt 5 minutes of your time. So I'm being honest, right? Because I mean, in the pediatric office, there's no pediatric office that I've been to recently that doesn't have a full room of patients, and they have 8-minute visits. And so I think what people should do is they should say, can I come in just to talk to the pediatrician and ask these questions, and make sure that the office doesn't say, well, this is your first visit. So, they have a bunch of agenda they need to get through, weight, height, all these things. And so, I would say it's a good question if you're meeting them, but if it's because you're there for your well child check, then you're going to miss some things because you got 8 minutes. You can choose how you use your 8 minutes.
Yeah, that's why probably I've never been asked the question. Is usually there are so many things that I'm asking the patient that they don't have the opportunity, or it's never occurred to them to ask a question of a pediatrician. I have had parents interview me in the past, and it was primarily regarding their concerns around vaccination and their desire not to vaccinate. And that's the only reason I've ever had patients ask me questions about myself, I would say. Yeah.
Yeah. Well, it sounds like we can put that response into the fact that all these questions we're going to talk about could be burning up your 8 minutes, and you might want to consider them wisely, but it doesn't mean they're not good questions to ask.
Absolutely.
Right. Yeah.
Absolutely. No, I think that's a great question.
Yeah. So the next one is, and I'm curious if like, why would I ask this question, and how is it relevant to having a doctor as a pediatrics is, do you have children?
I think this is a good question. I don't think it would automatically disqualify a pediatrician, but it gives you a sort of an idea of where they're coming from. So if a doctor has children, they're going to have some real life experience that may go beyond the textbook. If a doctor does not have children, they actually might have more time to spend on certain things. So there is sort of a balance there. And I think that becoming a parent has made me a better pediatrician. And it's made me probably more insightful about potential issues for families, or maybe ways to help them avoid pitfalls that I've already fallen into, basically, or I've seen people around me do. But I wouldn't say not having children is a disqualifying thing for a pediatrician.
Yeah, I'd say that, it gives you practical knowledge. It gives you kind of real life skills rather than, what does a textbook say or what are my parents telling me? By being an actual parent, you're like, oh, that,
Yeah.
that didn't work for me, but it works for some people, or this really worked for me. And so,
Well, I have to give you both kudos, because over the course of the last 6 weeks, when we've talked about this subject about being a new parent, you have very quickly gone back and easily and seamlessly gone back into your knowledge of actually being a parent, and then weaving in being a doctor at the same time, and really humanize that whole process. I would think as a new parent, I would appreciate that. But as you say, it's not a knockout factor one way or the other. I like how you said, Dr. Burris, of like, hey, if you don't have any children, it means you have more time to spend on this with me. And but some parents may want to, like, hey, have you ever eaten ice cream? Yes. Well, then I want to buy ice cream from you. So it may be one of those things too.
Yeah.
But it seems like a fair question. Yeah. Let's take one more and then we'll wrap up for today. And this seems like a pretty good one. Is how long have you been in practice?
Again, this is a general question that's going to give you an idea of where that doctor is and sort of their career. Just because someone's older doesn't mean they've been a doctor for a long time. There are people who go back into medicine as a second career. And so I think a good question to ask is not just how long have you been a pediatrician, or how long have you been a doctor, but what kinds of places have you worked, or what kinds of jobs have you had? And you may find that your doctor has like this really interesting sort of patchwork of places they've worked, or they may have worked in the same office for 40 years and have tons of um, sort of connections within the community. And again, neither of those things are bad. And also, being a new doctor, it has pros. The doctor often is very energetic and will go the extra mile. Sometimes when we've been around for a long time, we can get a little burnt out or jaded. And so, sort of seeing where your doctor is in that process, again, it's a window into the human side of your doctor and where they are in their life. And some doctors, honestly, might not tell you as much as others. Some may really guard that information about themselves for one reason or another. So that's another caveat. You can ask all these questions, but some doctors may be more forthright and others may guard their information and hold it a little closer to the chest for a variety of reasons.
Yeah, I mean, there are pros and cons of getting a brand new grad. I mean, they aren't as experienced, but it also means they're going to grow with you and they're going to be around probably for the life of your pediatric child until they're 18. Whereas if you get a seasoned pediatrician, that's good, but you don't know when they're going to retire. And so
Right.
you might have them for 1, 2, 3, 4 years and then have to go through the whole process again. So
Well, I think has been a nice starting place, just to kind of ask some questions. And here's a suggestion, or a thought process of, because this particular website gets the scary mommy gets literally millions of viewers every month. It's interesting to think, hey, that must mean that if they're doing their job, they're probably saying, hey, these are common questions that are being asked or need to be asked by those new parents. And it seems to me like going back onto a doctor's website and seeing if they have any of these questions answered would be a place to not have to worry about that 8-minute, but also you as the pediatrician to say, hey, here's how I have a little bit of time to actually answer that question, to field some of these top 60 questions, if you will, maybe only take 10 of them, to allow me as a as a new parent to say, hey, I just went through an interview with you, but you didn't have to spend any time with me. Does that make sense?
Yeah, and I think that's a fabulous idea, because a lot of these are questions that a lot of different patients will have. And having a website that's readily available that people can just go and find the answers to will save some of the time when you do meet face-to-face for either follow-up questions or different questions you might have.
I love it. Well, guys, hey, welcome to the new year, 2022. Let's keep our fingers crossed that the Omicron variant is rapidly moving through, and it's going to be one of those things where in a couple 3 weeks we'll say, well, okay, we made it through that, and what did you say, 12 to 15-year-old shot will be approved by then.
No, it's already.
Oh,
the booster has been approved.
No, it's been approved by the FDA, but not recommended by the CDC. So there's this combination of events that needs to happen. And normally we pay no attention to it because it takes like 2 or 3 weeks. But now we're like down to the minute.
The track record is the CDC has not gone against the FDA with anything with COVID. So.
Oh, really? Okay.
Yeah, but sometimes they tweak it. So we'll see what happens.
Hey guys, if you're out there watching and you're not, you weren't here live, but you watched it on at another time, and you have a question, this is a live show, so we always invite you to put your questions in the comments, and then Dr. Burris, Dr. Kim will be able to jump back in and answer those at some time down the road for you. The other thing is, I want to take just a moment and please share with them a little bit about the Coachella Valley Direct Primary Care and the model. And also I'll put along the bottom of how to get a hold of you. And then we'll just call it, we'll say, hey, Happy New Year, and we'll see you next week.
So Coachella Valley Direct Primary Care is a direct primary care model, which is a membership model. And although many of our patients have insurance, we don't bill insurance for our clinic. So people pay their monthly membership fee, and then everything that we do is included in that. If we have to send people outside of our clinic for certain things like labs or radiology or specialist care, then we like to utilize insurance for them so that it is covered. Because of that type of model, we don't have to have thousands of patients. So we're able to keep our panels smaller and be able to actually be a little more responsive because we don't have the overwhelming amount of workload. So that means that when people need to come in, we can bring them in propitiously. We also have the ability, because we're not having to fulfill the insurance company's billing requirements, if a problem is better taken care of over the phone, we'll do it that way, or with a televisit, or over a secure app with a text feature.
Yep, we decided to open this kind of a model because we wanted to give the families of the Coachella Valley a good alternative where you're able to access the healthcare that you need for your family, whether that's preventative levels or urgent matters. And the current system doesn't really allow that. And so being a direct primary care physician, we can absolutely see people same day or next day. We can come in on the weekends. We can answer texts and phone calls that are appropriate. And, you can get your healthcare to the goal you want it versus the current system that makes that very difficult. And no fault of any one thing. It's just, it is what it is. And so we wanted to be able to feel good about taking care of people and people being able to feel like that they're getting taken care of.
Well, there you go. They answered those first top three questions, but the biggest one is what's their why? And they just want to serve you as a potential client and member. They just want to serve you better. So, with that, I want to wish you guys a great week and welcome to the new year. Let me just make that so we can see everybody. And just remind you that this is live on Mondays, 11:30 p.m. or a.m. PST. Please join us. Invite somebody, bring a question, and leave with answers. Dr. Burris and Dr. Kim, thank you so much, and we'll see you next week.
Happy New Year.
Happy New Year.